You're watching Good Evening San Diego.
Welcome back. November is Lung Cancer Awareness Month. It's the deadliest form of cancer in the U.S., leading to an expected 135,000 deaths expected in 2020. Scripps Memorial Hospital Encinitas has new technology hoping to lead to early diagnosis. And here now to talk more about it is the Director of Interventional Pulmonary Medicine at Scripps Encinitas, Dr. Samir Makani. Dr. Makani, thanks so much for joining us today.
Hi, thank you for having me.
Okay, so let's start. We know that early detection, especially with something that has death rates so high, it is critical for patients. So with this new technology, step us through exactly what it is and how it's helping, maybe compared to what we used to use in past years.
Absolutely. So, we're truly excited to offer this new technology to our patients. It's a highly advanced robotic-assisted system for diagnosing various lung diseases, including lung cancer. Traditionally, bronchoscopy has been around since the 1970s. It's done through a procedure where we use a tube to enter through the mouth and go into the throat and then back into the lungs. But it had its limitations based on vision and access to different portions. With this new robotic system, we're able to advance deeper into the lung to more challenging locations with better accuracy. And ultimately, the goal is to give patients an earlier, more accurate diagnosis, particularly related to lung cancer.
Wow. And we're watching right now a video of what this new technology actually looks like, obviously a simulation of it, going through and really giving you that precision that I was reading maybe wasn't as accurate until now. So this really truly is fascinating to watch. Definitely something that is so minute. And this is something too that you combine with a CT scanner. Why is that important?
Right. So traditionally, when we've done these procedures and the actual taking of the tissue via biopsy or placement of a needle, this has been done with the use of X-ray, and that's a two-dimensional technology. So with the use of CT scanning, we're able to visualize in 3 dimensions exactly where we are, and this is to help us improve more accuracy and ensure we're exactly biopsying the exact location we want to and we're intended to be biopsying.
Okay, I've got to ask too, because I'm wondering if maybe I'm the only one thinking this, but of course right now we know that COVID-19 has such an impact on our lungs. I know that this is for lung cancer, but I got to ask, is this going to be something that maybe we could potentially see being used in this pandemic as we start to wonder what those long-term effects are going to be on people's lungs who are diagnosed with the virus?
So presently, COVID-19 is causing a multitude of lung issues and lung problems and scarring to the lung and other findings. And there is a possibility that in the future, as we move more into the convalescent phase or the chronic phase of the illness, particularly around lung disease, that there may be these spots where we're unsure whether this is related to a scar from COVID-19 or whether this is progressing lung issue that may be cancer. And in that situation, yes, absolutely, this may be helpful.
Wow, that is just another one of those things, too, that shows just where our technology is taking us. Now, final question for you. Tell us, this is something that we want to make sure we get out to our viewers. What are those early warning signs? When should they speak to their doctor, especially with a form of cancer that has such high death rates?
Right, so something to remember currently, this is Lung Cancer Awareness Month. And with that, in light of this world pandemic, we don't want to forget about natural things we do in and around screening. And so there is avenues for lung cancer screening available to certain criteria of patients, and we should definitely continue to do that. Lung cancer can vary from cough to shortness of breath to other symptoms like even coughing up blood. But anything that's continuing such a chronic cough, we shouldn't minimize that or forget about it in light of the current pandemic. Currently at Scripps, we're fully functional and open to see patients with the appropriate sterility and use of hygiene. And so we really want to encourage patients that although there is this ongoing world pandemic, that if you have an ongoing symptom, that it's important to get it checked out. And again, don't forget about lung cancer screening. It's a very vital and valuable avenue to figure out early lung cancer.
Absolutely, and something too that is so top of mind right now as we are all focusing on our health. Dr. Samir Makani, thank you so much for joining us. We know that this is a innovational technology. We'll be checking back in with you to see it as it develops even more. Thanks so much for being with us.
Great, thank you.